She was determined to provide me with a better life than she had herself. I remember we lived in a really tiny trailer. The water fell on top of the toilet, and the sink and bathroom was really tiny, about the size of my hands, and I have very small hands. The kitchen table was stuck to the wall, and so was my bed. I found that pretty interesting. I remember one hot summer day. Arizona gets really hot. I'm not sure if you've ever been there. It's hot. One summer day, my mother gave me $5, and she sent me off to the store. She said to get 1 tomato, a lettuce, a packet of ground beef, and a packet of corn tortillas. I was to walk to the store. It was about 7 blocks, but to a starving child, it was about 7 miles. So on my way home, I ate the tomato. So when I got home, she wasn't too happy. She accused me that I wasn't the only one starving. So it was selfish of me, but I wasn't sure. I didn't know everybody else was starving. I thought I was the only one starving. So things didn't get any better for my mother. She had trouble finding work, juggling her own needs with the needs of her daughter. My mother's American dream was surely and slowly dying. At age 13, I ended up in the foster system. My mother lived with an abusive husband, and she could no longer care for me. I never returned home. I don't really blame my mother. She thought that this country was going to be able to provide us with a better life. At age 14, I knew that I didn't want the life that my mother had. So I wanted to find out what that American dream that she came to this country was. I had the tenacity. I had the ganas. The ganas is what we call desire. I had the desire to succeed. I probably had just about every opportunity in life, the bad temptations thrown at me, but I resisted. My own success in making it productively through my childhood is a result of determination, but also luck. I have seen so many just like me fall into the system. I saw a very thin line that separated me from them. But what if they had resources to help them deal with the poverty and the lack of education? What if the poor and the sick had a proper entryway into getting help and care? 17 years ago, I started working for Esperanza. Esperanza means hope. Esperanza's mission is to improve health and provide hope for families in the poorest communities of the world through sustainable disease prevention, education, and treatment. I'd like to tell you a story about Savannah. When I met Savannah, it was as if I was looking at a young version of myself. Savannah's situation was a little different, but her level of risk of falling into a cycle which she cannot come was exactly the same as mine. She lost both of her parents to drugs. She and her brothers became foster children, and years later she lost her brother to a drunk driver. Savannah eventually went to go live with her grandmother, who was also trying to get by. Savannah could have easily become a statistic, a drug addict, a teen mother. She could have fallen between the cracks. I met Savannah at a community center while I was a health worker there. Esperanza was there to enhance the health program that was already there. My role was to assist the prevention education program and the Christmas Angel program. As I was helping Savannah's grandmother fill out the application, I automatically fell in love with this little girl. After a few years of working with Savannah, her grandmother signed her up for the Esperanza's nutritional pilot program. The greatest health risk that Arizona's communities, some of the communities have, that our people face are obesity, heart disease, diabetes, and chronic tooth decay. These are not random facts. Poor do not have access to fresh or affordable produce. Many get their food from food banks. Without the proper education to understand issues like caloric intake, proper dietary requirements, Empty calories, the dangers of too many simple sugars. The poor are in jeopardy from suffering diseases down the road. We teach our students to read food labels. How many here know how to read a food label and understand it? Good. Not too many. And we teach them how to balance a healthy diet. It's the little things that most of us take for granted that plague my community. Proper foods, hygiene, safe parks, and access to health care. How can anybody follow their American dream when they don't have or know how, they don't have access or know how to access their basic and essential needs? Through this class, Savannah learned about the importance of reading and understanding food labels. She learned about positive body image and how to advocate for healthy snacks at her school. And she also learned proper oral health care. Because of these classes, the chances of her becoming diabetic have decreased. The chances of her having tooth decay have also decreased. And as a foster child, and being on an Affordable Care Act, she has saved everybody money. Through my life, I've seen poverty all over in places like in Maricopa County and Arizona, and in communities in Latin America. My takeaway, poor is poor. The same issues that hinder my community plague every economically challenged community around the world. Sure, there are differences, but every community is filled with children who have hope, children who have dreams. There's nothing more precious than those children who can dream. Sometimes as I drive through my community, I can see that little girl carrying the groceries that she bought with the $5 her mother gave her. She was starving, she couldn't help but to eat that tomato. This is why I can't leave that community. I know them, they know me. They speak my language, I speak their language. They trust me, they identify with me. Because I live their struggles and they see esperanza in me. Savannah is now a young lady whom is extremely involved in her school, community, and about to graduate from high school. She's planning on attending Arizona State University, and just last week I had the pleasure of helping her with a scholarship that I'm sure she will receive. I can't wait to see her succeed. She is chasing the American dream, a dream that's painfully elusive to the poor, where if it wasn't for resources like Esperanza and others, Savannah would not have a chance. I don't know what she will make with her life. It is up to her. Perhaps she'll be a doctor, a lawyer, or a healthcare worker. Who knows? Perhaps one day she will be here speaking about her life and the community she lives. Little thing here, my girlfriend put together. She literally went to every community that I've worked in and she put a little pebble in there. Oh. So she just wanted me to say, I have every community that I'm representing here with me today. Wow.